So I'm thrilled today to introduce Rifka Coleman. And Rifka was a client at one of our grantees, one of our funded programs at Family Reach. Rifka is from Charlotte, North Carolina, and we are thrilled that she has come today and will share her story. So without further ado, Rifka, we would love to hear from you.
I feel like that picture, John, is just, it doesn't do me much justice these days. Thank you so much for having me. It is always such an honor to be here and to share in the success of being one of your Pro Bono for Cancer recipients. Like any other Pro Bono for Cancer recipient, my story starts off with a cancer diagnosis and the shock that comes from that. I don't know if anybody can ever prepare for cancer, although you would think with the statistics being what I think 1 in 2 adults will actually get a cancer diagnosis, you would think we'd be more prepared. But at 37, a busy mom with a plethora of children at home, right at that time, my kids aged from 19 months to 20, I was not expecting a breast cancer diagnosis. The subtype of breast cancer that I had was one of the most rarest and hardest to treat, called triple negative breast cancer. And with that came an extreme amount of treatment. So my treatment started with IV chemotherapy for 16 weeks. I had 4 different types of drugs. After that, I had surgery that took my breasts. And then after that, I went into radiation. I had to have 30 daily radiation treatments, followed by another chemotherapy, which was an oral drug that I had to take for 6 months. If you've done any type of math in there, and I know you guys are good with numbers, it was almost 500 days of treatment. So let me back up. When I first started and got this diagnosis, we were a busy family. We had the same things that you guys are experiencing, whether it's after school care, to earner income, but we were financially just barely making it. You throw in a cancer diagnosis with having underinsured, if you will, where we had a $5,000 out of pocket. We did have to completely drain any savings that we had because in just 2 days from a biopsy to a full body MRI, I had eliminated that $5,000 deductible immediately. What that led to was us barely being able to make it. We were food insecure. We were not able to really meet the daily needs because I was missing work. My husband was missing work. This was in the middle of the pandemic. So we couldn't even have anybody come to our house and help us watch our kids. It was a struggle. We ended up with just 1 car. I barely being able to work. And then my husband was no longer an essential employee. So that left us with being even more financially strapped. I was still in treatment at this point, and I had to face a really hard dilemma. Should I finish treatment without insurance? My husband's job was lost. Or should I maybe take a step back? Maybe I'll stop treatment. I'm not sure if it's going to work anyways with my subtype. Odds weren't looking good. I decided that I was going to stop treatment. I figured, I can't leave my family with the amount of debt that would be stacked up, the hardship of my family, and we didn't know if it was going to work anyways. I immediately called my oncologist and I left a message saying, hey, I'm not going to come to treatment, lost my insurance, we can't afford it. We can't even afford to park at our hospital. It's so expensive. The amount of bills that were just stacking up, we needed to feed our kids. We didn't have gas money to get me to treatment. She immediately put me in touch with a social worker. The social worker, it was really a gateway. I see that now. And I'm so fortunate to have a social worker at my hospital because I know a lot of people across Middle America do not have the access to that. The quality of that service is not there. But this social worker put me in contact with nonprofits. They were to help me get emergency funds because We were renting. We weren't able to make our rent. We had hardly any income at that point. Helped me get in contact with food sources, really, and helped me immediately. Helped me get in contact with my state insurance for a breast cancer program through Medicaid, and really helped me get on my feet. And about 30 days from that point, I got connected with a financial planner. I was given this gift of a financial planner through one of the nonprofits that I had worked with for emergency resources. And the first thing I thought was, I don't need a financial planner. I need more finances. And that was my first mistake, was not understanding really what does a certified financial planner do. So I was gifted. I always call him my knight in shining armor, and it's because he came in such a meek form of an email. And he reached out and he tried so hard to get in contact with me, but I was not feeling well. I was in the midst of treatment, struggling to keep it all together during a pandemic nonetheless. And he was so sweet. He reached out, he kept giving me great advice and said, just let your guard down. Let me help you. But at this point, I had been stripped of so much, not just health-wise, but the vulnerability that you have to allow yourself to really let go and allow somebody to peek into all dark corners of your life. I decided to give it a go. He reached out, we talked through it, and he was so great to be able to bend around my time because I was in such an extensive amount of treatment and not feeling well for several days after those treatments. But he took a peek into my finances. He asked me for all of the things to diagnose my situation. It's like this holistic approach that I really didn't understand because I didn't know anything about finances, right? I had no finances to even worry about how to plan them. And I love, John, how you said, like, it's not just for the elite, like anybody can utilize these resources. So my financial planner, Pat, sat down with me over the phone. It was all virtual and it was so easy. He was able to help me find money that I had no idea that I was leaving on the table. Really good tips and tricks about, how to save money on certain plans, get my student loans set up on income-driven repayments, leading me with a $0 amount of repayment. There was money that he found in my insurance plans, in my cell phone bills, and these really added up. It added up to a point where we were able to feel a little bit more secure. I always love to add in here that Pat didn't just help us with our finances, financial planning, or our long-term goals. What he helped was rebuild our confidence and our esteem with our finances so that we felt more in control. He continued to pepper us with really, really positive outlooks on how we can help our situation long-term. And so once we were done, Pat and I were done kind of with our time. It was over about 6 months or so. I felt more confident. I was leading up to exiting treatment, so no longer in that active treatment. I was able to get myself back on my feet. My husband and I both got new jobs, making almost double the amount that we were. And to us, we really owe it to our financial planner because he helped instill that we are worth it, that we have that in us, that we were worth more, that he just kept giving us so much confidence in it, in our finances, that we felt empowered to do it. So later on, now I am almost 3 years removed from that. I love talking about how everything's come full circle, that we were able to buy our first house. We are 2-car family now. We are better than ever. As our time and our long-term planning evolved, we have so many big goals, and it's all because of those foundations, that basics that we learned. And now I love to talk about it. And although it seems full circle, my husband lost his job again through a merger last week. And you're like, how are you smiling, Rifka? You've been through so much. How is this good news? It's because of those foundations that Pat taught us. We have ample amount of savings to bridge us, and our investments that we've been able to make over the last 2 years, because of those foundations, those building blocks that he instilled in us almost 3 years ago, that we feel confident that we are not worried at all. I love to talk about financial planning so much that I myself have applied for a scholarship to also become a certified financial planner. So I have all of that to thank because, John, of your program. And I am here today to tell you that I am almost 3 years cancer-free and on my way to financial freedom. So thanks.
What an amazing journey. And you're absolutely a remarkable person in your family to go through that and to come out the other side stronger than ever. And I'm so glad that you are doing well health-wise. I'm not glad to hear about your husband, but I know you guys will be okay. And you have a really, really strong knowledge base. And I absolutely love the fact that your interaction has led you to be interested yourself in pursuing becoming a certified financial planner. It's really, again, a remarkable journey, and we can't thank you enough for becoming an advocate for this work. And for sharing your story. So if you'll stay with us at the end, if there's questions, would love to bring you back on in a little bit, if that's okay.
Yeah,
thank you again.